you see the need of a patient and you want to fulfill our hospice motto to help individuals live with dignity through the final days of their life. And they can live with dignity. There doesn't have to be pain. There doesn't have to be suffering. There doesn't have to be everybody's afraid and nobody knows what's happening. We can't pinpoint when someone is going to die. We can't always make everything right. But when you go home at night and you've done your best, when you've been in a home, and while you're in that home, that's the only patient you have. You have all your attention focused on them. You're not running in and out. You're not just herding them through. You're taking your time. You're listening. And that's probably 75% of my job is listening. We try to alleviate pain, anxiety, answer questions. We don't have all the answers, but sometimes we don't have to have an answer. We just have to be an ear, someone that can listen to what's going on.
I love my job as a hospice CNA, and I get to spend so much time with patients and family members. And, you know, I've been a CNA here and I've been a CNA in other healthcare facilities, and I feel like what I do means so much more to people here than it has in the other places that I've worked. You know, it just doing simple things like helping somebody with their meal or just sitting with them and holding their hands. It's just, it means a lot to me. It means a lot to the patient.
You always hear people say, I wish we called sooner. I wish we called sooner. I have never, ever had a patient or a family member say, I wish I'd waited. I never hear that. You know, everybody wish they called sooner, because it's not just, a lot of times when they wait until a couple of weeks before the patient passes or something, the family doesn't get the benefits, the patient doesn't get the benefits that we offer. A lot of times it's harder to get the patient's symptoms under control. We can still get the symptoms under control, but it's harder because it's so far in. It takes a little longer to get the symptoms under control. They just don't get the full benefit. You know, a lot of times, I mean, we have so much as admitted the patient, and they pass sometimes the same day. They just don't get to see how well we all can work together with that patient and that family. They just don't get the whole benefit, and the family doesn't get the benefit either. There is not a nurse or a social worker or a spiritual counselor or an aide that I would not let take care of myself, or any family member that I have. There's not one that works for hospice that I would not let take care of somebody in my family that works here. Any one of them, I would feel like it was a privilege to let any of them take care of somebody that I know.